wanted to thank everybody for joining today. And actually, this is the first webcast that we've done as a company. So I'm the CEO of RTOS Incorporated, and we've invited a panel of esteemed physicians to go through their experiences with NanoBone in sports medicine and trauma cases today. So Sean McMillan is going to moderate today. Sean is the Chief of Orthopedics at Virtuo Willingboro Hospital in New Jersey. So Sean, I'm going to turn it over to you, and I'm going to step into the background.
Well, thanks for doing this for us. Certainly during this time of, I guess, the COVID-19 pandemic, many of us have become more traumatologists than sports surgeons. So it's certainly a unique sort of blend. We've got a really nice sort of group of people that sort of round us out today. We have Dr. Nirav Amin from Loma Linda, California, who has recently changed from a employed model over to a private practice model. We have Dr. Scott Fawcett, who's on the line from Washington, D.C. Scott's a very well-known gentleman on the East Coast here for complex knee as well as hip procedures. He spent some time serving on boards for ISACOS, as well as he's worked with the U.S. Snow team and is a team doctor for George W. University. And Gil Ortega, who's our traumatologist and probably the man who can give us the most input when it comes to this out at the Mayo Clinic in Arizona. He's director of trauma out there, and we're really going to sort of just look at different ways that we can look at bone grafting and how it's changing our practices. Our first speaker tonight is going to be Dr. Nirav Amin. And Nirav, you've kind of got an interesting practice, right? You're primarily a sports physician by training, but you also do some arthroplasty. Is that correct?
Correct, Sean. You're absolutely right. So, predominantly my practice is made up of sports medicine, and I do adult knee reconstruction. And I'm going to kind of go over a couple cases of use of NanoBone technology that I've started to incorporate into my practice. There's a little more kind of on a broad spectrum that we can talk about on a larger scale a little bit later, but just in a setting of a couple cases, I think that's really